Hello, everybody. I'm Dr. Echols, and this is a lovely Corrina, who I'm sure you're well familiar with. And she is graciously put herself up on the table so that we can check her out and see what we're going to do. I'm a doctor of chiropractic, and today we're going to be examining Corrina to see if we can determine if there's anything going on that she may not even be aware of. I think we spoke, and you don't really have a lot of problems that are going on right now. And we did a video earlier of a young lady who was having no outward symptoms, but yet when we examined her, she had some issues that were going on that I believe, if were left untreated, would go on to cause problems later. You've all heard that you can pay me now or pay me later type of a situation. Well, that's what we're going to find out. Many times, almost always, patients come into the office because they have a specific problem, and we address that. However, we oftentimes find things that they were completely unaware of, but really needed to get fixed. So I'll demonstrate a little bit about how we do that today, and hopefully you'll get some good information to take home with you. Corrina, you ready to get started? Mm-hmm. Let's have you lay on your back for me. And this really requires a little bit of patient participation. You know, I really need her to just kind of stay with me. She can't just zone out on the table and go to sleep. I really need her help while we're doing this. So we're going to start with the upper extremities and just see what kind of muscles may or may not be working. Have you push back that way. Very good. And she's got a real good, strong muscle there. And we're not really looking so much for strength, but just that muscle has a good lock involved there. And hers does. And this one here, push back. Locks great. Push down. There we go. Push down. There we go. Turn this way. Push across the body. Very good. Rotate your arm this way. Push against my hand. Aha. Try that again. Push down. Wait. Let's do this right. You're just going to rotate against my hand. Okay, so this is a great example. This muscle that isn't working now is called the subscapularis muscle, and it's probably the most important muscle in the entire shoulder. It is the muscle that provides stability to the shoulder. When I find this muscle weak on somebody, I really caution them to not be doing push-ups or not be going to the gym and lifting weights, because the shoulder is literally unstable. And if they do that, they're probably going to tear up something else. So I always say, let's get that muscle fixed. Let's get the shoulder nice and tight and stable. Then you can go work out to your heart's content. But before that time, she runs a real risk of injuring something else. So next one is the infraspinatus. Push back that way. And that one's working great. Put your hand underneath here. Don't let me pull this up. Very good. Push out that way. Excellent. Teres major and minor muscles. Push up that way. Very good. Supraspinatus. And real tight to the body here. Very good. Okay. And I'm going to come around to the other side and check these. So here we are on the other side. We're going to check the posterior deltoid and push back for me there. And she's trying to push, and as hard as she can, but there's just no strength there. Is that what it feels like to you?
Yeah, I'm trying to push really hard.
You're trying to push really hard, but it just fails. And this isn't because Corrina's out of shape. She's in wonderful condition. This is because she's got a neurological weakness in the muscle. In other words, something in her body, and it could be anything, is shutting that muscle off, just like a circuit breaker is blown here. And remember, she wasn't hurting. She has no pain, no problems at all. And that's where the value of this applied kinesiology comes in, because we're actually able to go in and find problems long before she does. So I happen to know that from experience, this problem is usually related to a cervical problem, in other words, up in the neck area. So, Corrina, I'm going to have you turn your head all the way this way, and then I'm going to have you put your chin up for me a little more, like that. And then I'm going to repeat the test, push back, And you see how you get your strength back.
Yeah.
She immediately got her strength put back into her arm, and that's all we did was just reposition her head. Now, of course, Corrina can't walk around like that all day. She wouldn't be able to see where she's going. But we know now where we need to adjust. So I'm going to come back over here on this side. The posterior deltoid was weak. We had to reposition her head into this position and caused it to strengthen. I happen to know that this muscle is supplied by the 5th cervical nerve here, which is about right here in her neck area. And this vertebra needs to be moved in a very specific way, in a very specific direction. That's why it's probably not a good idea to let anybody start messing with your neck who's not trained to do so. But we're going to just gently make a little correction here.
Whew.
There we go. How'd that feel, Miss Corrina?
I felt amazing. It was so loud.
Yes, it was. And now we'll come back over there to this side and we'll recheck the muscle, push, and now she's got perfect strength in that muscle. That feel a lot stronger to you now?
It felt totally different.
So this is just a really great, simple illustration of how we access the body to find problems. We start with a weak muscle, then we let the muscle show us where the different problems are. I don't really even rely on much where the patient tells me the problem is, because it could be anywhere. The pain could be localized in one area, but the problem could be somewhere completely different. With this technique, it'll always lead us to where the problems are. So now we're going to re-challenge, kind of tap that muscle that challenges it so she can push back again. And it's still holding and it's really strong. So she had one of the vertebrae in her neck that was out of position and it was shutting that muscle off. All right. So what we did, we found this weak muscle that was here, and we kind of let that muscle show us where the different problems are in her body. In this case, it was coming from the 5th cervical nerve in her neck was being pinched. It was being pinched in there, bones out of place up in the neck, some kind of dysfunction going on there. We made the adjustment, and it was like flipping a light switch. She immediately got her strength back in her arm, which means that the treatment that we did was very effective. Now, here's the point. She didn't hurt. She wasn't having any problems or any pain up in her neck beforehand, but she was having some dysfunction that I'm sure she wasn't really aware of unless people are going around testing her posterior deltoid for her, which I don't think that's been happening. Is that correct? That's true. So if she would have left that vertebra out of position over years or months or years, there would have been some arthritic changes that start to take place. Degeneration, DJD, degenerative joint disease, would have started taking place. And eventually it would have turned symptomatic. And then you would have started complaining that you can't turn your head so much, or it kind of hurts in the mornings when you get up, or you could start having pain radiating down in your arms or numbness in your hands. These are real common problems that we have. And now it's about 80% broken when you start getting these kind of symptoms. So wouldn't it be great if there was tests just like the one that we're doing where we can find these problems when they're 10%, 20% broken instead of 80% broken? And that's what we just did. So I really love this applied kinesiology for this. This technique is wonderful for this. Now, she also had another muscle that wasn't working, and it was the subscapularis muscle. And I explained that this muscle is probably the most important muscle in the shoulder. And I wanted to retest it again. Rotate your arm down. And it's just really not working that great. So we are going to work on that muscle. Open your eyes for me. Close your eyes. Good. I don't see this muscle all that often. So one of the points that is out on her is right. I always like to test for it. Don't forget to push. Right there.
It's tender.
And it's tender. And then she's not going to like this, but we're going to kind of get under her armpit right here and go to right where the subscapularis muscle is. It's usually pretty tender.
It's very tender.
Yeah. And I'm not very squeamish about putting my hands in people's armpits because that's the way I have to do it to fix them. And again, we are feeling for pulsing, and we're going to get these pulses here on her clavicle and on the head of this muscle to synchronize. Okay, let's check it. Did that lighten up a little bit?
Yeah, it did.
Okay, well, let's just keep going. Push. Okay, so we kind of got off cheap today. Apparently that was really the only thing that was needed to be done with that. So we will take her out of that file and we'll recheck the muscle now. And now push down for me. And there, it's much, much stronger. Yeah, do you feel stronger now?
It's totally different.
So it's interesting to note that sometimes these problems, there can be a lot of layers of problems, kind of like onions. You know, you could have several vertebrae that are out of place. You could have an organ that's affecting this muscle. She could even have emotional trauma that could be affecting this. But in this particular case, there was only, I believe, one point that really needed to be stimulated, and I really needed to get on that muscle itself. And once I did that, it kind of tripped the circuit breaker. The muscle went right back to function again. I should say reset the circuit breaker instead of tripped it, because it was tripped. But now it's much better. And using applied kinesiology, we can actually find these weak muscles. And believe me, I get patients that have sometimes 10, 12 muscles that aren't even working properly. And we just take them one at a time. And remember, the muscle isn't the problem. It's showing us that there is a problem somewhere else, but it leads us right to them. So I hope this has been of some benefit to you. Be proactive. If I would suggest that maybe you do a search for applied kinesiologist in your area and see if that doesn't turn up something that you can utilize to be proactive and try to get some of these problems taken care of before they take care of you. So hope this has been helpful. This is Dr. Jeff Echols. We look forward to seeing you next time. Bye-bye.
Hey patrons, it's Corrina and Missy. Hello.
Hey patrons, this is Jess.
It is Greek Goddess Hour continued.
And we are here with an exciting update for you.
Going to be more interactive, more communication, more connection, so that we can offer you more of what you want to see.
It's like the most frustrating thing. You're like, God, this video is going so great, and then the camera dies.
All right, patrons, so I just want to show you all my perspective here. All right, let's do your city.
You're choosing us over Netflix, or
Right?
I wouldn't even choose us over Netflix.
No, that's not true. Feeling pretty lucky. And what we want to do is become more connected with you.
So thank you so much.